Yes. All right, starting the timer. Here is the question. Right, so if you have read and understood, kindly begin your station.
Hello.
Yes.
Hello.
Hi, my name is Dr. Ishfaq. I'm one of the doctors working under Mr. David. So, could I check? I'm speaking to, can I confirm your name?
My name is Mr. Wilson.
Nice to meet you, Mr. Wilson. Actually, my consultant, Mr. Amin, he is busy with some meeting with the administration. So, he sent me to discuss with you an investigation we have arranged for you. So, before proceeding to that, can you please tell me what do you know so far about your condition?
Doctor, as far as I know, I've been told that I'll undergo a procedure called OGD, and
Okay.
a camera will be introduced through my food pipe, and you're going to take some samples for testing. I know only this, but could you tell me more about this, please?
Okay, great. As you are perfectly right, we have arranged an investigation for you that we call esophageal gastrodynoscopy, that we abbreviated as OGD. What we actually do in this test, we put a camera which we call endoscope through the mouth. Okay, so from the mouth down to the food pipe into the stomach and first part of the small intestines. Okay. What we do before this, we numb the posterior surface of the posterior of the, so back of the mouth with some spray, local anesthetic spray, or we can do it under sedation. It might be some, it won't hurt you, but it may be a little bit uncomfortable. As in your case, you have some constriction, you have some stenosis constriction in the food pipe, so we'll be
Doctor, what
doing it with
is stenosis, doctor? I don't understand stenosis.
yes, let me tell you. The stenosis like constriction in the food pipe, so in your case we'll be just
or narrowing. Narrowing.
Yeah, so we'll be doing in your case under a general anesthesia. Okay, so
all right.
The camera we will put through the food pipe. It will take pictures from the food pipe firstly, and then down in the stomach, and from the first part of the small intestines, and those images will be relayed on the TV screen, so we can visualize whole of the food pipe, stomach, and first part of the small intestines as well. And there's one more advantage. At the same time, we can take a biopsy tissue, tissue from any suspicious lesion, which we think will help us to make a final diagnosis in your case. And at the same time, we will be dilating the narrowing part of your food pipe that should be relieving your these symptoms which you were having previously. Okay.
Is it going to be painful, doctor? I'm really scared now.
Okay, I appreciate your concern. It shouldn't be painful because we are going to do it under GA. But in the post-op period, we will advise you, like, you won't be go to home on the same day, and you can't drive on the same day. So you need to be under observation, and someone needs to be with you. So it shouldn't be painful.
Is there any risk associated with this?
Yeah, nice question. I appreciate your concern, as there is no risk. There's no procedure without risks. And in this case, starting from like while we take the biopsy, while we take the tissue, that side can bleed at times, and most of the time that stops on its own. And patient can have sometimes the teeth can break from the insertion of the endoscope. And one most dreadful complication, which is very rare, but there's a possibility that someone can have like puncture in the food pipe. So in that case, we may need to. I'm sorry to say that, but this is a remote possibility. But these procedures are not usually done by someone like who is not trained. These are done by this extremely trained professionals. So we'll take care of that. But there's a possibility. You should be knowing that.
Oh my God. Okay, wait. There's going to be you're going to cut my. There is a chance that you might cut my food pipe. Like I'm scared now. I don't want to have an operation now. I was told it's going to be a very simple procedure. I'm really now
Okay.
apprehensive
Appreciate
regarding
your
this
concern.
procedure.
Yeah. Appreciate your concern. But as I told you, this is a remote possibility of this, like 1 in 2,000. There's a remote possibility, and in your case, this will be done by a highly professional and highly skilled consultant. So you shouldn't be afraid of this. I think my opinion, we should be going with this, as this investigation is very important in your case. There's a remote possibility.
Oh, okay. But doctor, why do I keep salivating all the time?
Yeah, nice. Good question. Because the narrowing in the food pipe which you are having, that's actually preventing the secretions that are produced in your mouth to go into your stomach. That's the cause of your like drooling of the secretions from your mouth.
Oh, okay. Doctor, I'm really concerned. Could it be cancer?
Yeah, like Dr. Main, like we can't be sure that it's cancer. It's not like 100%. I can say you right now it's cancer, but there is a possibility it could be cancer. But that would be we can be exactly sure about that once we'll do this investigation and take the tissue, and the results of these tissues will be available to us after 2 weeks. So right now I won't be giving you the definitive diagnosis. There is a possibility, but that won't be confirmed right now.
Okay. Okay. So after I do this procedure, when will
Okay.
my results be available?
Okay, great. So your results will be available. Usually it takes a time period of 2 weeks. So after 2 weeks, we will be discussing the investigation reports with you in the OPD. As soon as they will be available, we will be calling you and we will discuss the report with you in our OPD. Okay.
Oh, okay. Okay. So for this procedure, do I have to stay hospitalized?
Yes, you are right. You're going to undergo this procedure under GA, so we will be admitting you 1 day before the procedure, and for that we need to take some precautions about your eating as well. Like you have to stop eating 12 hours, like 1 day, 12 hours before the procedure. And if the procedure is going to be in the morning, the investigation is going to be in the morning, however you can take some liquid, that will be okay. But if you have this investigation late in the afternoon, you can take some light breakfast and take clear fluids 2 hours prior to the surgery, prior to the procedure.
Okay. All right. So have you seen my investigation?
Yes, I have been through your blood reports that showing you have low hemoglobin level and your liver function tests are not good. And there is what we call a bilirubin that has been raised in your case.
Oh, okay, doctor.
Mm-hmm.
All right, then I will then go ahead with the procedure.
Eating around the time
Okay.
of the ODD.
Okay, thank you. But before...
Oh, can I?
Okay.
Okay, all right then. Thank you, doctor.
Instruction
Okay,
of
thank you.
about
So
avoiding the hot drinks,
I would...
and then patient asks about Keeping
I
around,
would like to
yes.
summarize.
Yes.
So I would
Yes,
like to
please.
summarize what we have been through. So we
Yes,
have
of course,
discussed it.
doctor.
Well, we have discussed it that we have arranged an investigation called esophageal gastrodynoscopy for you. So I have discussed there we'll put a camera through the food pipe down into your stomach and the first part of your small bowel. We'll take pictures and we'll take biopsies and some tissues if we suspect some lesion, and we will dilate the narrowing part of your food pipe. And finally, you have agreed that we should be doing this investigation. And in the post and before that, you have to be admitted with us 1 day before the procedure, and the post-op and the post procedure you will be with us for the 24 hours, as you can't drive. And finally, you're happy for us to proceed with the investigation. Is there anything else you want me to tell you?
Doctor, I actually occasionally drink. So can I continue this after the procedure?
After the procedure, our opinion would be you shouldn't drink. Will be of that opinion.
Oh, okay. All
Okay.
right. Is there anything else I should avoid?
Like in your case, you are going under GA. So if we have been doing it under local anesthesia spray, so you should have been, in that case, you should have avoided the hot drinks in the post procedure. And in your case, you should avoid this driving for next 24 hours.
All right. Thank you so much, doctor.
Thank you very much. But I will be leaving my number with the nurse on the counter. If there is anything that pops up your mind, please feel free to contact us. Okay.
All right. Okay, doctor.
Okay.
Thank you, doctor.
Okay. Thank you.
Good. Thank you.
Thank you, ma'am.
Thank you.
Yes, feedback. Anyone wants to give them? It was good. Like they have come to discuss like in a coherent way.
Doctor, ma'am, if I could,
Yes,
Dr.
please.
Ishfaq.
Yes.
You did good. You did amazing, mashallah. The thing about today is you used a lot of, I think, medical terms.
Medical
yes.
terms. Yes.
I used a medical jargon, but at the same time, I was trying to
you
correct
used some
it at the same time.
Yes.
I was trying to correct it at the same time.
Yeah, when you
trying to
said
explain the jargon.
constrictions, I heard that, but you said stenosis. So I was like, okay, let me, because they might come and ask you what is stenosis. Then, yeah, that's about it, I think. And rest all you are completely prepared. It is good. It was a good
Thank
one.
One question, like he said, under GA, all right. You can say it will be done under sedation.
Sedation.
Yeah,
Deep
like
sedation.
try to use terminologies which are used by the layman, not by the physicians. For physicians, here, okay, we are discussing and we are understanding, but like if you have to talk to a person who is not known to medical terminologies, they will not understand what is GA or what is local. They would not understand.
Okay.
So
Great.
it's better to say no, since yours is planned under sedation. So what you have to do, then you can, I think maybe you told, or I don't know, a patient should stop eating after midnight.
Yes,
and all
ma'am,
that.
he did, ma'am.
Yes.
He did, ma'am. He did, ma'am.
And then
that's
you have
about
to
it.
check understanding. You, instead of you summing it up, you ask the patient, okay, can you summarize it, what we have discussed? So you can just confirm
yes,
it.
ma'am. That
patient
I was
has,
aware, but
yes.
I thought I am running out of time.
You
so
were running out of time. Yes, correct.
Yes,
actually,
yes.
time ran out. But
Yes,
still,
yeah.
like, yes, you can keep this in your mind.
Yes.
And the thing is, Dr. Ishfaq, today you are being very comprehensive regarding the points. Like,
No,
to the
he is
point
improving.
answer.
He's good. Yes.
That way, yes,
tremendous.
ma'am. That way, the time constriction you would be able to handle.
Yes.
Like what Dr. Abhishek was saying about the time.
Even the energy level was superb. So thank you so much.
Yes. Thank you so much, ma'am. Thank you, Dr. Ishfaq.
So
Thank you, ma'am. Thank you.
Would want to go